Eric Ford is a 28-year-old male who was brought in yesterday night at 2 a.m. experiencing auditory command hallucinations. His command hallucinations is a report of hearing voices, and he says that the voices are telling him to kill himself. He has had three previous psychiatric hospitalizations for this same thing, as he's a diagnosed schizophrenic. Those hospitalizations were at ages 23, 25, and 26. He did have a lapse in taking his medication, his risperidone, because they had a lack of insurance coverage for the medication, so he did not take it for about a week. This is corroborated by his mother, who is his primary caretaker, and she reported via phone call that he's had increased paranoia, insomnia, and decreased concentration throughout the past week, as well as a decrease in appetite. Eric reports hearing voices for the past 5 years, and it has worsened in the past week. They've just been telling him to die and continued suicidal ideation. He does have one previous suicide attempt when he tried to overdose on Tylenol. Assessment-wise, his vital signs are stable. His blood pressure was 120/80. He's sitting at 100% on room air. His heart rate was 88. His temperature was 38 degrees Celsius. And his respiratory rate was 20. His breath sounds are clear bilaterally. His S1 and S2 is audible, but no extra heart sounds were heard at a regular rate and rhythm. There's no evidence of self-harm. He just does have some scattered bruising on his skin, and I did not witness any involuntary movements. But he sometimes does forget to eat. Mental health assessment-wise, he has a poor general appearance with signs of lack of self-care. He did have suspicious, guarded, and evasive behavior during the interview. His speech is good. He did have a stable mood, but a flat affect, so his mood and his affect were incongruent. He did have some word salad and clang associations present while he was speaking. He does have presence of suicidal ideations with those auditory hallucinations, like I mentioned before, but there is no homicidal ideation. He demonstrates concrete thinking. He lacks the ability to think abstractly. His remote and immediate memory are intact. He does have awareness of his illness and a willingness to seek treatment. He demonstrates good judgment. He is alert and oriented ×4. Denies the usage of drugs. He reports drinking alcohol socially. He says he'll have a beer every once in a while with his friends. He is a pack per day smoker since the age of 16, and he is on risperidone for his schizophrenia, and he also has trazodone prescribed for insomnia. So he has been given those antipsychotic medications since he has arrived here. A safety check has been done. He doesn't have his belt, socks, or shoes anymore, and he's on Q15 checks, and recommend that those would continue. And further recommendations would be to help him and his mom with finding consistent medication coverage so he can have access to that, because his stay here likely could have been prevented if he had continued his medication instead of being off of it for a week. Maybe get them help with applying for state help or insurance or assistance in that way. Just help his mother recognize the positive and negative symptoms of schizophrenia, so that between the two of them they could, recognize earlier and get him treatment earlier for worsening symptoms of schizophrenia. Continue to help him develop his coping strategies for hearing voices. He had mentioned that he likes to listen to music already to help with hearing voices, so to continue helping him develop and educate him on that. And then also set up and then follow up with him that he's going to his outpatient psychiatrist appointments.